Yeah, thank you. Good afternoon, everyone. I'm Dr. Ramesh from Department of Plastic Surgery, Victoria Hospital. We plastic surgeon, we treat diabetic patients every day. Diabetic foot is one of the commonest patients we get in our OPD. I thank the organizers, Dr. Sanjay and Dr. Pawan. They have been working towards the diabetic foot and foot care since long time. Every meetings we meet them, they work a lot of studies and lot of to combine technology and clinicians problems. They are working towards that. The dressing is one of very minor aspect of management of diabetic patients. It's a very since they asked the industry talk, nothing related to our this thing. The Convatec, the concerned facts, on behalf of Convatec, I'm talking here. So the diabetic foot is very common problem to each and every surgeon, and the multifactorial problems. It needs the physician, diabetic foot surgeons, all the podiatric departments, the footwear, offloading and microbiologists. As a multidisciplinary management is required. The dressing is the very minor aspect of the management of in looking for the best dressing in the diabetic ulcers. Is the major problem in our OPD. Almost we are talking to surgery HOD last week. They see around 300 patients of diabetic foot patients every day. They run the diabetic clinic. One of the highest patients where we see in Victoria Hospital for diabetic ulcers itself. They come with bad wounds, needs a lot of debridement and saving the limb and toes is a major issue in the thing. In the clinicians, no one wants the amputation of the toes. Even a small toe, they don't want amputation. They want to save their toes and they want to save their foot. So the preventing the complications of diabetes in the diabetic foot is the major issue. The patients will not be willing for amputations. We have to find out the problem very early and address the issues as early as we can. What we see in the looking for the dressings, I'm talking on behalf of the Convatec. In the dressing aspect, what we see, majority of the surgeons are happy with the saline dressings and the simple gauze dressings. Whatever we talk advanced dressings, most of them are happy with what they practice regularly. Still, we have to advance in our care and we have to look for the best what is available in the market, not only in the best interest of the patient. What we talk or what we discuss in advancing technology, we have to see in the end of the day what is good for the patient and which makes the complications lesser and the outcome better. So in any dressing, we look for which we can reduce the infection and we can reduce the amputation and improving the quality of life, outcome of the thing. Ulcer should heal faster and the better healing to prevent the further complications. And the cost is also the major issue in our healthcare. Like we have to weigh the cost effectiveness of the dressing and the outcome of the total. As a whole, we see the patient, which is expensive. The lesser price and the best outcome we have to look for our Indian scenario. The moist dressings, like the principle of any dressing is to maintain the moist environment for the better wound healing, so which prevents the dryness of the wound. The many patients will ask, can I leave open the wound so that it's dry and heals faster? It should not heal, it should not be too dry or it should not be too wet also. We have to just manage the wound in between, like to help the wound in the better, giving the better environment for the wound healing. So the Convatec dressings helps in to preventing the tissue dehydration and helping in the proliferative potential of the wound and increasing the debridementing agent, autolytic debridement. This dressings helps, and the surgical debridement is still today. Whatever the debriding agents, the dressings, the surgical debridement remains the mainstay of any diabetic wound management in debriding the dead tissue. The surgeon plays a major role in the early management of the wound and wound debridement. There are many debriding agents like dressings and the enzymatic debridements. Still, it is the combination of all the treatment, the surgical, enzymatic debridement and the dressings, the reconstruction. Each and every small step plays a major role in the better outcome of the patient. These dressings helps in the interaction of the growth factors and targeting the faster healing, faster granulation tissue and the epithelialization of the wound, and reduces the infection rate also is reduced. Infection plays the major role in the delayed wound healing, and reduction of pain during the dressing, change of dressings and all. Each and every small point is very important for the patient in the better outcome. Even the change of dressing, the less pain during the change of dressing is also very major. A lot of patients, if there is a pain at the time of dressing, they don't come for dressing. So the small aspect should be taken care of in view of the patient. What patient feels is more important than our technology, our advancements or our knowledge. There are some very important rules in managing the dressings. Each, like in diabetes, the major issue in diabetic foot, each wound is different, each patient is different. What we see, we cannot set a common standards for diabetic foot care. Like each patient we see is different. The patient behaves in a very different manner. So we have to individualize each wound, each patient and treat accordingly. So we cannot this dressing should be followed for all the patients. We cannot fix anything in the diabetic. What we see small ulcer today, tomorrow they come with a big abscess inside. Or what we see big wound, suddenly it starts healing in a better manner. So we have to individualize and treat the patient accordingly and giving each importance to each and every wound and each and every patient. The basic rule is if it is too wet, the wound is lot of discharge, reduce the discharge, make it optimum moisture, and if it is dry, give the moist dressing. So you have to select the patient. So each time we cannot dictate the dressing pattern for the patient. So other thing is moist environment you have to, so that it helps in the faster wound healing. The golden rule is to maintain the moist environment. So the Convatec, the product, what Convatec company has got, Aquacel Ag and the many other brands they have. This is one of the dressing what we commonly use in diabetic ulcers. So it's like just we have to manage to reduce the exudate and preventing the problems of exudate in the surrounding wound, moisturizing and maceration of the wound, and infection. To control the infection is also other major issue. These two things we have to taken care of in diabetic ulcers. So the biofilm, what we talk in all scientific meetings to break down the biofilm, whether by surgical debridement and using these dressings, they help in breaking the biofilm formation and help in faster wound healing. The hydrofiber technology, what the Convatec projects, it helps in preventing the exudate and containing within the wound, avoiding the maceration of the surrounding wound and reducing the infection rate. And the silver technology, what they have, it helps in the better outcome of the wound healing. These are the few, reducing the bacterial colonization. These are some advantages they claim. To summarize, healthcare providers they should have knowledge about advanced wound dressings. What is best for the patient we have to use. So sometimes the simple gauze dressing is best for the patient. Wherever it's required, we have to use advanced wound dressings. To have knowledge what is new in the industry and to use it for the best outcome of the patient is more important, and primary importance is our patient outcome and the patient. Thank you.